2 years ago, I went through a pregnancy very similar to the Kate Cox abortion case in Texas. At 12 weeks gestation, I received an extremely abnormal ultrasound. No doctor in my entire state of Oklahoma could diagnose it. They just knew it was bad, so I was offered an abortion. When I refused, my maternal fetal medicine specialist offered to rush an amniocentesis at 16 weeks so I could make a more informed choice. He wanted to check for genetic disorders such as trisomy 18, the same exact condition that Kate Cox's daughter has. When weighing the possible risk of miscarriage associated with this procedure, I asked my MFM, is there any way these genetic results could yield a possible treatment plan for my son? And he said no, because it wasn't about that. And he stressed abortion again. When I asked if the suspected conditions could in any way increase the risk to my health during the pregnancy, he said absolutely not. Even though I had 2 blood clotting disorders, a history of pulmonary embolism, a VP shunt from pseudotumor cerebri, a kidney calcification, history of frequent UTIs, and recent COVID, he said giving birth to a disabled or stillborn child would increase my health risk 0. And yet again, he offered me an abortion. And yet again, I refused because I wanted to spend every heartbeat with my son, whether he was disabled or not. And I want to tell Kate Cox and other moms who might find themselves in the living nightmare of a prenatal diagnosis, you can choose life too. You are strong enough to birth your baby. An abortion heals no one.